Good morning, everybody. It's Dr. Brace here. Welcome to Facial Plastics Friday. And for this week's topic, I wanted to talk about scars. Last week I talked about pigmentation, and a lot of that was focused on creams and how treatment of pigmentation is a marathon, not a sprint, that nobody gets rid of their pigment immediately. And the same is sort of true of scars. So any surgical procedure that you have done will create a scar. There is no such thing as surgery without a scar. You can hide scars. So an example would be a transconjunctival blepharoplasty. We can go through the inside of the eyelid and hide the scar inside, but there's still be a scar on the inside. We can do a brow lift and have the scar hidden at the hairline or within the hair, but there still will be a scar. One of the things I often get asked about is if I have a facelift, if I have a rhinoplasty, if I have a brow lift or a blepharoplasty, will I have a scar? The answer is absolutely 100% yes. There is no way to do surgery without having a scar. But scars can look very, 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 very inconspicuous and hidden if done well. There are some surgical factors that your surgeon needs to take into account, like where light and shadow hit the face. We call those aesthetic subunits. Scars hide well if you hide them along aesthetic subunits. We like to hide scars along the hairline or along where two structures meet. So an example for a facelift scar would be at the hairline, up, then around the ear where there's a natural kind of contour change, in behind the ear, then down the back hairline. There will be a scar there, but it should be a thin, white, flat line. That's the ideal scar. There are different scar scales. The Vancouver scar scale is probably one of the most widely used, but a perfect scar is a thin line, like a pencil line. It's faded white, it's not raised, it's not thickened, and that's what we're shooting for with surgery. So just keep that in mind. If you're considering a surgical procedure, no matter what it is, you will have a scar. For the upper eyelid scar, for a blepharoplasty, it hides in the natural crease. If you open and close your eye, everyone has a natural crease there, except for some a population of Asian patients where they don't have that crease, but that's called the supratarsal crease. We hide it in that crease and often in a little crow's foot to the side if we have to extend the incision. We put them there in wrinkles and lines so that they're hidden, but they're still present. And so what can a surgeon do to give you the best scar possible? Well, you want to take into account the person's skin. You want to take into account if there's any tension. Ideally, a scar should have zero tension on it. So you want to use a closure technique that allows the skin to come together without any pulling. Often that means releasing the tissues and the ligaments around what you're closing, undermining, and then using layered closure, using a deep layer of sutures that will dissolve but will hold tensile strength in the wound, and then using a surface layer which really just approximates the skin edges, everts them a little bit, which means have the edges come up and meet each other, because we know as the scar heals, it will contract and flatten. So for all the residents out there or surgeons in training, a perfect closure would be having your suture spaced evenly, having zero tension on the wound, having the smallest suture possible to attain the tensile strength for the closure that you need. So I really like 6-0 Prolene, sometimes 7-0 Prolene. For thicker skin, you sometimes have to use a 5-0 Prolene, but I rarely go bigger than a 5-0. Layered closure with monocryl or vicryl sutures or something equivalent in the deep layer to hold things closed. And then there's all of the post-surgery scar care. So I like to get stitches out around day 6 for most people. Between day 5 and 7 is ideal. If you have a layered closure, you don't have to worry about your incision opening up, because there's another layer of sutures, of thicker, stronger sutures underneath, holding everything together. You don't want to leave your sutures in the skin for too long, because you can end up with train tracking. Now, even if you take your stitches out early, you can still end up with train tracking in some people, but ideally if you get them out early, you avoid having that like dot, 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 dot along the edge of a scar. After the sutures come out, this is where scar creams and scar care is really important. You can speed up your healing, like half of the time, or double the speed of the healing, by keeping your wound clean and keeping it moist and greasy with an ointment like Aquaphor. That helps the skin re-epithelialize, which gets watertight sooner. And then once it's watertight, you can start using things like silicone on it. Silicone scar creams have lots and lots of science behind them to show that it gives you the best looking scar possible. Things like bio oil, vitamin E, aloe, Mederma are all fine. There's just not as much research. So if I was going to put something on my scar, I would use silicone. And then things like the Vbeam laser and the CO2 laser are great adjuncts. The Vbeam laser takes the redness out of a scar, it helps flatten the scar, it helps speed up the resolution, but it will take your scar a full year to heal. So no matter what surgery you have done, no matter what scar, whether it's a little tiny mole removal or a facelift scar, it will take a full year of that scar maturing and basically changing until it gets to its final form. The Vbeam laser helps take the redness out of it quicker. The silicone helps keep it flat and also helps with redness. But you will be in a year-long healing process as new collagen forms, as the skin kind of remodels underneath. So I hope that's informative. Things to remember, no matter what surgery you have, even if it's hidden scars, you will have a scar. It will take a year for that scar to fully heal. So you have to be patient. You have to go into surgery knowing that this is a process of healing. Scars can be hidden, and proper closure and scar care afterwards can make them as imperceptible as possible. When people end up with bad scars, it's usually because there was too much tension. It was because they have a genetic predisposition to make a keloid or hypertrophic scar. And in those cases, we need to intervene with steroid injections, fluorouracil injections, more lasers. And knowing ahead of time if you have a predisposition to that is really helpful for your surgeon, because sometimes at the time of closure, we can use different techniques to try to avoid ending up with a keloid or an unsightly scar. So send me your questions about scars. I hope that was informative. Everybody have a great weekend. Happy Facial Plastics Friday.